let's know some interesting facts about the sciatic nerve. Due to its close proximity to the ischial bone, the sciatic nerve is also referred to as ischiatic nerve. It is also called as pregnant nerve owing to the presence of pulsating artery running within it, appearing under ultrasound like a beating heart of the fetus. Interestingly, calling it a nerve is anatomically a misnomer because sciatic nerve lacks its own connective tissue like endoneurium, perineurium or epineurium like any typical peripheral nerve. Instead, it is nothing but the compact paraneural sheath which is the loose connective tissue lying between the epimysium of the surrounding muscle and the epineurium of the nerve. This paraneural sheath is also referred to as sweet spot of the nerve as it's the ideal target for the local anesthetic injection in a successful blocks. The sciatic nerve is essentially a mesoneural sheath holding two nerves, the tibial and common peroneal nerve, each having own connective tissue layer, endoneurium, perineurium and epineurium. Thus, the sweet spot for the block lies outside the individual epineurium but within the common sheath. Hence, the subparaneural injection is preferred for effective and safe blockade. Sciatic nerve is the longest, largest and the thickest nerve in the human body. It contains around 1200 to 1500 myelinated axons and more than 20,000 unmyelinated axons. The longest axon in the body, running from the sacral roots to the base of the great toe, is also part of the sciatic nerve. The human sciatic nerve is notably larger than the quadrupeds, reflecting the high sensory demands of the bipedal movements. Activities like dancing require refined proprioceptive feedback from the feet and the lower limb, far more than what quadruped need for the locomotion, as they lack same level of balance and precision control. Despite its massive size, the sciatic nerve itself does not directly supply any muscle or the skin. In terms of the motor supply, all hamstring muscles in the thigh are innervated not by the sciatic nerve but by its component, the tibial nerve, except the short head of the bicep femoris, which is innervated by the common peroneal nerve. Among adductors, all the muscles are supplied by the obturator nerve except adductor magnus, which has a dual supply, one part from the obturator and other part from the tibial nerve. The sciatic nerve has no distant cutaneous supply in the thigh. The cutaneous innervation of the thigh comes from the posterior cutaneous nerve of the thigh posteriorly, which is a branch of sacral plexus, lateral femoral cutaneous nerve of the thigh laterally, which is a branch of lumbar plexus, and anteriorly by the anterior cutaneous nerve of the thigh, which is nothing but the branch of anterior division of the femoral nerve. The holding sheath of the two components merge with a fat layer in the popliteal region, releasing the hold between the tibial and the common peroneal nerve. This results in the divergence of both the components after disappearance of the common sheath. That's why we call it as a sciatic nerve always bifurcates. It doesn't divide. The proximal part of the sciatic nerve is highly vascular while the distal part is relatively poor vascular. Therefore, adrenaline containing solutions are preferred in the proximal blocks to act as a vascular marker but not recommended in the distal blocks where further compromise of the vascularity may lead to prolonged block duration beyond expectations. The tibial nerve and common peroneal nerve are always separated by the septum, which is known as a Koku septum, even within the common sheath. This septum can lead to uneven spread of local anesthetic, resulting in partial or patchy blocks, especially when injected at the bifurcation.